Hello and welcome to the Health Bridge podcast. I'm your host, Holly B. Happy to have you here today. Today I'm speaking with Sarah Irwin, and I'll go ahead and read her bio to you. So, drawing from a rich tapestry of experience, including a decade-long nursing career and a lifetime devoted to energetic healing, Sarah offers a holistic approach to well-being that transcends boundaries. Through immersive workshops, virtual sessions, and rejuvenating retreats, she invites you to unlock your innate capacity for healing and renewal. Sarah's methodology is rooted in reducing stress responses and harmonizing the body's natural rhythms, utilizing a unique blend of shamanic wisdom and energetic modalities. And whether you join her on the yoga mat, in a virtual healing session, or in the sanctuary of her healing space, she guides you towards a state of profound balance and restoration. Driven by a relentless thirst for knowledge and growth, Sarah's journey is a testament to the transformative power of continuous learning. She is a certified, I may be pronouncing this wrong, Terai Mai or Terai May and Kundalini Reiki master teacher. She's a shamanic healer, a yoga instructor, a craniosacral practitioner, and more. And she embodies a commitment to excellence in her craft. I love that she comes to this with a background both in holistic, energetic practices, as well as having an in-hospital nursing background as well, because it really gives her the ability to see things from both sides and to understand that these things can actually work. Western and Eastern can actually work well together. And in fact, she recommends doing them both side by side. In this conversation, we talk a lot about how to improve your experience in the Western medical system, how to present yourself in a way where the doctors and nurses will respect you and listen to you and minimize the gaslighting that goes on. We speak a lot to the gaslighting as well, and the experiences, especially of women going into the Western medical system and not being seen or heard. So we really address like how, this is an issue. It shouldn't be, but it is. So how do we work the system in a way that is going to benefit our experience and get us the help that we need? Beyond that, we do go into the energetics of the body and how past experiences lodge energetically in our system and can lead to physical pain in the body. This is a topic that I've been talking about with a lot of the different people that I've had on my podcasts recently. And because I love getting all of their experience and input on this subject. And Sarah definitely sees this with her clients because as she works on them energetically, they can actually get to those root causes, the root of the triggers that trigger these health crises, these health experiences, or even trigger the anger response or the relationship patterns that we have or the thoughts that we have about ourselves that aren't serving us. And she can actually help get to the root of, oh, I had this one experience in childhood, or I had these multiple things that added up over my childhood or throughout my life that have proven this feeling to me. And that's how it's expressing now. She can help them move that energy through and clear it so that they can actually feel lighter and move forward instead of being stuck in that space. So that goes again with health things, physical health things, mental health things, energetic health things. So I can't wait for you to listen to this episode. I'm going to zip it now and let you dive in. But before we do, I would love to ask you to take a moment to hit that subscribe button. I'd really appreciate it. It makes a big difference in the reach of my podcast and in the reach of the messages that myself and my guests put out here on these episodes. These are important things. These can enrich your lives. These can help you lead a healthier, stronger, more authoritative role in your life. And that all has a trickle down effect. The more we empower ourselves, the more we can support and empower others. So thank you for taking a moment to do that. And with that, we'll dive into the episode with Sarah Irwin. Sarah Irwin, welcome to the Health Bridge podcast. I'm really happy to have you here and to dive into some of your story that I know a lot of my listeners can relate to. So thank you so much for being here.
Thank you for having me. I'm excited to chat and dive in.
Definitely. So one of your big topics that I just want to jump right into is medical gaslighting. You come from a nursing background and I've seen a lot of your posts on Instagram where you reference all these crazy things that happen between doctors and patients. And a lot of my listeners have dealt with this, especially because they are women and also dealing with autoimmune issues and trying to figure all that stuff out, which can be really hard to diagnose. So they've been lots of times told time after time, it's in your head, you're just stressed. Maybe it's just your cycle or fill in the blank, all these other excuses because their blood work looks fine or because they're a woman, so they're probably just taking too much on their shoulders and they just need to chill. So what take that wherever you want. I'd love to hear your experiences and if that had anything to do with you actually stepping out of the Western medical system.
Oh, yeah, absolutely. And like you said, us women, we tend to get the brunt of this. The medical gaslighting is no joke. It's been well documented over the years. It's something that I feel we simply cannot ignore anymore. It's so evident, whether it is in the history of women's health care, where we're not actually studied. I think it was last year was the first time even the women's full sexual organs were in a textbook. So if that doesn't say red flag right there with regards to women's health, I think we're just in a
Sorry,
lot. Yeah.
what?
Yeah. Okay. I know this is out there, but the clitoris was not in a textbook until last year, from what I've read and from what I've researched. And I think that is crazy. And then if you look at medical studies and medications, the vast majority of them have not been conducted fully on women as a whole, right? That's again what I've researched, what I have learned to be true. And I think a lot of the things that we see and experience as women when it comes to the medical system is the fact that our physicians just aren't educated on the female body, the female anatomy, our hormone cycles, and the fact that we do cycle very differently than men. And I think that really has laid a foundation for negligence or just really brushing our health issues off. I've heard from a lot of different women, as have you, that we've been ignored, we're not being heard, we're being brushed off as it's just your cycle, you're making it up, it can't be that bad. Whereas if we flip the script and it was men who were having to have parts of their body taken out that they relied on for reproduction, we would not be having the same outcome, the same brush it off, suck it up kind of thing. It would be taken much more seriously. And so for a lot of the clients that I've seen, myself included, as well as patients when I was nursing, this was the number one complaint that I heard on a daily basis from female patients, that they're not being heard. I've seen so many women leave the doctor's office in tears. I was one of those women, in my early 20s, really in my late teens, my early 20s, over a span of 6 years, I was going through a whole bunch of medical interventions, trying to figure out why my body was shutting down, what was going on, why I was having so much pain. And I think I left probably 95% of those appointments in tears because I was told it's just your cycle, it's in your head, it can't be that bad. Meanwhile, I would be sitting in the doctor's office, physically shaking, tremoring, sweating through my clothes, in so much pain it felt like shards of glass were ripping my skin. And I was still being told it was in my head. This wasn't real because my labs were coming back, quote unquote, normal. Whereas if you had a man presenting, I truly feel that if a man was presenting with those ailments, they would have been on the gurney, IVs in, getting some medication. There would have been much faster investigations done. And I think that where we're at today in society, we're really starting to shift those norms, shift that narrative where women are speaking out more, and individuals such as yourself and myself and a whole bunch of other amazingly strong women and social media individuals, people who are being seen and heard a lot more, really taking the narrative where this is unacceptable and really calling for change. And I think when it comes to our health, we really have to advocate so much more efficiently than we have been. I feel as women, we sometimes brush things off. If they ignore us, we just take it as it is because we don't want to disrupt. We don't want to come off as being rude or annoying or being that squeaky wheel. And I think we have to. I think we had a saying in the doctor's office, the squeaky wheel gets the oil, or see her first because she's going to call and call until she gets an answer. And that really goes to say the more you advocate for this yourself, the more you stand up for yourself, the more you're going to be able to be heard and seek treatment. And it's so pathetic and so wrong that we have to do this as women. I think we just, the more we can do this, the more we can learn how to advocate for ourselves, the more we're going to be able to shift this narrative so our daughters, our granddaughters will be taken seriously and not have to go through 4, 5, 6, 10 years of investigations and being brushed off in order to be heard and taken seriously. So that's something that I've been teaching, is how to advocate for yourself as a woman in the healthcare field, how to present in Emerge or in the doctor's office so you're taken more seriously and receive the care you need to receive. And I think by doing this, and I hope by doing this, we can really put this forefront on that we're not tolerating any less. We deserve the same healthcare as men. And I really hope that this becomes one of those things in society that we don't have to take as the norm anymore.
So when you are working with women, how are you teaching them to advocate for themselves? Because there are right ways, or effective ways, I should say, of advocating versus ways that might not be helping your case be heard, right? So
Absolutely.
yeah, how do you teach women to do that?
Yeah, so I have a few different ways I go about this. As I'm an energetics practitioner, I study bioenergetics. So that's the one way, is being in tune with your own intuition, knowing your own body. That is huge. That's the number one thing, is knowing yourself, knowing what's normal for you, knowing how you feel on a regular basis, so then you can pinpoint exactly what's going on in your body and explain it really efficiently so that someone else can understand. This is not normal for me is a big key phrase that I like to use when I go into the doctor's office, and that immediately gets them to pause typing and look over and give me their attention. That, and there's different tricks of the trade to how you present yourself, to things you can say. Just to go over a few things that I tell my clients is, one, besides leaning into your intuition, listening to your own body, you need to present, because as sad as it is, if you present in sweatpants, a beat up shirt, your hair everywhere, you may not be taken as seriously as someone who's in a tailored coat, clean shoes, hair put together. If you present really like you're put together, and I'm not talking about putting on like a fancy tuxedo or anything, but pull yourself together a little bit, put your hair back, slap on some moisturizer, do something so you can appear like you're serious and you're not in that state of frazzledness. I think you're going to be heard a lot more, because what I've seen over and over again working side by side the physicians is the ladies that would come in straight from work in their business casual or business attire. They were in and out with a prescription in hand or a referral, and the doctors would come out of those interactions feeling a lot more confident, a lot more at ease, and they would fire the orders, "I want you to do this now." Whereas the other ones, they would come out, they'd roll their eyes, and it was almost like another crazy woman. So that's exactly how we don't want to present, as that other crazy woman. And I know it sounds absolutely ridiculous and it infuriates me to even have to say that this is something I've seen. If you can just even throw on a nice coat over top of sweatpants and just throw your hair in a ponytail, that's going to make a huge difference than going in completely frazzled. And I know there's time and place for everything, but if you have a scheduled appointment, that's going to be something that's going to make a difference. The other thing is really articulating well what it is you're going through. Have your things documented. This started on Saturday, and this is what it felt like. And then it progressed to this, and then it eased off. And when I had this last month, this is what happened then. And if you can show a pattern and show that you're really serious about what's happening, you've investigated, you've collected your research on your own body and what's going on, it's really going to help the doctors decode what's going on. But it's also going to show that you're serious as well. It takes it to that next step, that theme of just coming in, not really knowing, not being prepared. It's same with a job interview. So when I go into the doctor's office, I think of it as a job interview. I'm going to prepare. I'm going to look the part. I'm going to really be able to articulate what it is I'm feeling. Even if I'm in like 10 out of 10 pain, I still have words and phrases in my mind that I'm going to say. So that leads me to the next thing, is really being clear and concise as to what is going on. Not just saying I'm having pain in my stomach. I'm having sharp stabbing pain on the right side of my stomach and it radiates to my back. It's 10 out of 10. And the one other thing is that as women, I've read a bunch of articles where it says you almost have to double or bump up your pain points on the pain scale by 2 points. So the pain scale is 0 is no pain, 10's the most pain you've ever had. If you're sitting at a 4, you almost have to bump it up to a 6. And so doing that is just going to be able to, depending on where you're at, obviously, but doing that too may help. But as well, being able to really articulate what exactly you're feeling in your body. It's feeling pressure. It's feeling like using those descriptive words to really articulate what it is that's going on, I think is super important. And then possibly the most important thing of all, because we can go in, we can have everything together, but if we're not kind and respectful, you might as well just expect to be taken care of last. You have to be kind and respectful always. Whether you're agreeing with what they're saying or not, they are human beings at the end. And this is where my nursing bias comes in, because as a nurse, I think every single day I nursed, I was yelled at, I was spoken down to, I was completely disrespected. And those are the people that we're not going to be as willing to go out of our above and beyond for. It's like with anything, right? You go into a fast food chain and you talk really rudely to the person that's helping you, they're not going to be wanting to help you. Same with a parent or a sibling or a friend. You wouldn't want to help someone who speaks poorly to you or speaks really rudely to you. So really just being aware of your tone, being aware of how you're talking, simply saying thank you, or I don't know, have a good day, or something like that is going to make a big difference in your care, because we are, at the end of the day, underneath it all, human. So always being kind. And I don't know, I know so many nurses that when the client presented, even if they couldn't articulate, even if they looked frazzled, even if everything else wasn't happening, but they were kind, they would go above and beyond to grab that warm blanket, grab them the water, make sure the doctor was hustling to their room first. They will go out of their way for you. And it's just one of those things, I think, in any service industry, because that's really what it is. It's a service industry. We're going to be able to receive better care when we're kind. So
Could not have coming from the service industry myself in the restaurant side of things, I couldn't agree with you more on kindness. Yes. Multiple things that you touched on there. I want to speak to. I think presenting well does make a big difference. And it's something that I never really took very seriously. I didn't really think about it, but it's true. You can look at study after study that says in any industry, really, any scenario, if you present like you're taking care of yourself and that you care, you will be taken more seriously. So I'm really glad that you talked about that, because I'm one to wear yoga pants anywhere that isn't going out to dinner at night. And when you're not feeling good, you want to wear just something cozy and comfy, right? So that's all you're thinking about. But making that little extra effort is huge, right?
Yeah, and even I was going through my own health kind of crisis the last little while, and I still wore the yoga pants, but I put my dress coat over. And
Perfect.
then I just pulled my hair back in a bun and just made sure that I still looked put together. So you can wear your sweats, you can wear everything, but just look like you put some effort in. And yeah, like you said, there's been so many studies that have proven this, and it's sad, but it's true. And I think we have to pay attention to the truth in those matters.
Right.
Obviously, completely
So
different if you're in a car accident or something, that's not going to have any effect. But we're talking about going in for appointments and things like that. Yeah.
exactly. Yeah. It's know the rules of the game and whether they're fair or not, you
Yeah.
have to learn to work those rules to your benefit, right?
100%. And doing your research too, right? If you show up and you know that you are needing a referral to dermatology, in Canada, we don't just go to the dermatologist, we have to be referred to one. I'm not sure if it's the same in the States,
Depends
but
on your insurance. Yeah.
yeah. Yeah, so going in and having a few people in mind, having a few words of mouth, talking to your friends, seeing who they use that they really got along with will also help you get that referral quicker because you're not gonna have to research and find that information themselves. They're gonna be able to go from what you've chosen, and then you're also gonna know who you're going to and have a better idea of who has your health in their hands, right?
Mhm.
So, just doing things like that is gonna make a huge difference. But yeah,
Yeah.
advocating for yourself, it's huge.
Yeah, and I think something that I've been in the health world, the holistic health world for years now. So I have done tons of my own research and I'm a huge fan of doing your own research and not just taking what a doctor or what the news or whatever is saying is the truth because I am the authority on me, right? And so I
Mhm.
think there's a fine line when I go to the doctor, and I've been very lucky, I think, with finding doctors that are open to conversation. But I go in knowing that I'm the authority, knowing that I already know a lot about my own situation. Even if I don't know exactly what's going on, I know what it feels like. I know what my history is. I already have my self care practices. I'm pretty well versed. So I go in as an authority, but I don't overstep and disrespect their knowledge as well. So
Absolutely.
you have to play that dance. And I just look at it as looking at them more as an equal. They're like an
Yeah.
equal partner in this rather than, hey, I'm lower than them and they're the authority and I have to do what they say, or I've done my Google research and yeah, they're a doctor, but they probably don't know about this. So I'm going to tell them. It has to be like a meeting in the middle. And when you approach it like that, they're surprisingly willing to have a real conversation and they come respectfully to you on what you've already done for your health and what you've learned. And you can have a different conversation in that way.
Yeah, absolutely. I actually just did this at I had to go into the hospital and I actually met with a doctor and like I had my research done and I went in and I presented her with what was going on in a very respectful manner and checked my tone. And then I was asking her, do you think this? What do you think the route we should go is? And I want to just hear your side, your opinion, your advice as a medical professional. And she literally just pulled up a chair and sat down and just eye to eye, just had this really calm talk, gave me suggestions and asked me, like, you're a really healthy person yourself. What's going on with your body? What do you want to do here? And it was a totally different interaction than I would have had 10 years ago, where I didn't know what was going on and I wasn't doing those things. And it's amazing the difference in care you get from doing exactly what you said and doing your research and coming at them at the same level rather than looking down on them or idolizing them too, right?
Mhm.
There's a lot of physicians I've run into that maybe have a bit of a big ego. And sometimes it's learning how to play that game too that we need to do and saying no, or I'm not sure if that's the best treatment for me. can we get a second opinion is also very powerful in your care. So playing that game exactly is something that we have to do.
Yeah. And it's empowering, but it's also hard to do sometimes. Say you're newly going through a medical crisis and you're freaked out and you're scared and
Yeah.
you really don't know what's going on, and maybe it's happened so fast you don't have
Yeah.
time to do extensive research.
Yeah.
So just I think maybe you can recommend, but maybe
Huh.
having a journal or
Mhm.
having some kind of little self-care practice to center you before you walk into the doctor's office to just help you calm and help you talk a little more clearly despite the fear and move forward in a good manner.
100%. I love that you brought up having a journal. One of the things as a nurse I always recommended, especially when we knew someone was coming in with a new diagnosis was rather not promising in nature, was to write down all the questions they had sitting at home. Write down all your questions, bring them in. Our policy was I would rather have you come in and talk to us than sit at home and worry. So coming in and just explaining, I'm really nervous about this diagnosis. I'm wondering if I can ask you a few questions to calm my nerves if you have a few moments. And just really asking those questions that you're sitting with and getting some answers and asking if there was a way or someone who you can talk to more about it if you are at home worrying. So you're not having to continue to come to the doctor. A lot of nurses, they'll set up a call that they can call the nurses and leave some messages, and the nurses can get back to them with lots of information that they're seeking. When I've had clients with those really rapid test results that we have to act on, regardless of the physician, whether they are big on their ego or very sympathetic, each and every one of them, the most beautiful thing I've seen is they've always accommodated some way, shape, or form to bring peace of mind to that client. So that patient. So you just really stating how you're feeling is not weak to the doctor, especially if it's a mental emotional that you're going through. You want to really speak that too, because then they can support that aspect of things. But not knowing is okay. Asking questions is welcomed. And asking questions is a huge way to put your mind at ease, especially there's no silly question. And I know sometimes we can really be made to feel as though we're asking a silly question or you silly girl, you should know that, or that's ridiculous. You're just not asking the right person. So finding that nurse or finding a second opinion, asking for that second opinion is maybe what you can do there too. But yeah,
Yes.
sometimes we go in and we feel frazzled. And I myself, I've nursed for years, but I've gone in and been completely frazzled. And that's where I say, listen, I don't know really what's fully going on. I'm not really taking in everything that's being said. So is there some way you can send it and get a printout of my files or my chart or my results? Can you write on there for me? And they'll in my experience, they've always done that. They've written out what it is I need to know, and they've been really grateful. So, advocating for yourself in that way, asking is something to do. And I think we get scared because a lot of the times we do see them as superior to ourselves, right? They're doctors. So we've been conditioned to believe they're greater and better than us. But end of the day, they're human too. We're all people. So just asking them and being human with them, I feel like they're going to support you. If they don't, just asking someone different.
That's great advice. Just if you're asking questions and you're not getting answers, you're just asking the wrong person. I love that.
Yeah.
Um, let's shift just a little bit. Say somebody's been going through a health experience of some sort and they've been going to the doctor or maybe multiple doctors and they're just not getting better. Whether they've figured out what's going on or not, whether they have a treatment protocol plan or not, they're not seeing the results. And when do you start looking elsewhere for some other answers? Because maybe we're not getting to the root cause of what's going on.
Yeah, that's a great question. When you start looking for different answers when you're not getting to the root cause, I feel like as soon as you find that you're not getting those answers, as soon as you don't feel satisfied, that's when you start asking. And even before then, for me personally, with my experience, it was when I was fed up A lot of times we wait and wait, holding out hope. I wouldn't recommend that. I would recommend as soon as you're not, if you've been to a couple of appointments and you're feeling like you're getting the runaround, if you're leaving frustrated, that's a big indicator to start looking elsewhere. I think alternative medicine and alternative healing modalities, they work wonderfully collaboratively with Western medicine. For me now, I always say to my patients, my clients, if you're going through something, at the same time you'd be making those doctor's appointments, start making your alternative modalities as well. Make time for those because they're going to work together really fluidly and you're going to get much better results. Generally, if you're going through something and there's a physiological, say, I'm not sure, say you're diagnosed with something terminal like cancer, and that's your diagnosis. If you start working with an alternative practitioner, it's going to help you. It's not going to interfere with your therapies. It's going to actually help you in your healing. It's going to aid your body in healing. And sometimes we have things where you go in over and over again. Say you have a reoccurring chest infection. You've been into the doctors now 3 times. This is the 3rd time. It's not clearing up. What's going on? Why is this still here? We've been for x-rays. What is next? Because now I'm starting to build an immunity to the antibiotics. What's going on here? And that's when I would go to an alternative practitioner as well. So I actually did, when I was nursing, we had a patient and she came in for the 3rd time in span of a few months with a reoccurring chest infection. She was not having any relief from any antibiotics. She was distraught. She was at that point where what is going on? I am not getting better. What do? I want to talk to someone else. And this was near the end of when I stopped nursing. And I had the courage to just break my nursing protocol a little bit and turn to her and I asked her, what happened around the time where these infections began? Was there anything going on in your life that changed around the time that you started getting sick? Was it an anniversary? And she sat there for a minute and I saw her thinking and she's, oh, my husband passed away. And I was just like, the chest is correlated with grief,
Yes.
right? And so she was getting these reoccurring chest infections. And I asked her then, I'm like, have you spoken to anyone? Were you able to talk to anyone about what you're going through? You must be carrying so much grief. I'm so sorry for your loss, and went through all those protocols. And I feel like a burden. My children lost their dad. My sister lost her brother-in-law. Everyone's grieving around me. I don't want to put more on them. So we ended up sending her. I had a talk with the physician and he's, oh, that's a great idea. So we sent her to some social work to talk and move through that. I gave her some heart opening exercises to do with the doctor's permission. And she came back like a month later. She had no chest infections. She looked like a totally different woman. But it's just that correlation between energetics and our physical body can be so huge and interwoven that you almost want to think of holistic medicine and alternative practitioners as your preventative health care. You want to be taking care of yourself so that you don't end up in the Western medical system. And if you do end up in the Western medical system, you want to use it as that go-between, that collaborative approach to really working on not just your body parts, right? We're not just parts of the car. We want to look at working on our mental, emotional, energetic, physical being as a whole. So that's something that I would suggest. You can wait or you can be preventative. And I think that is the best way to do is the preventative. But again, I feel like you'll know. You'll get to that point, and if you get to that point, that's generally where it's time.
Mhm.
If you can avoid it, that's great too.
Oh, absolutely, yeah, and we tend to go in cycles, right? Things are good for a while, so we maybe taper off of those preventative things, and then, oh, we get sick again or something else happens, and, oh, yeah, I realize I haven't been doing all my
Mhm.
self-care practices. I haven't seen my practitioners in a while. I better start again. For me, I'm like, "Okay, I really have to get back to the chiropractor." Like,
Yeah.
I can't just keep putting this off, right? But let's talk about the energetics, because you started, bringing up the energetics, and how things maybe move or get stuck in the body. And I want to talk about that energy flow because what I've gathered, what I've seen over the last 10 years or so of me really diving into working on myself, talking with other people that have long-term health issues, especially autoimmune issues, there tends to be some trauma or some type of emotional component when that thing started. And I think a lot of times people don't realize that, but it's my theory that whatever these little traumas were, whether there was something big or lots of little things and lots of just be seen and not heard when you were a child and always bottling things up. Like it could be a whole range of things. It could be a car crash and all of a sudden you're having rheumatoid arthritis type pains, right? Like all these things add up to stuck energy in the body and it presents in physical ways. Have you experienced that as well?
Yeah, absolutely. In fact, when I started to myself personally, when I started to shut down my own gifts as an energetic practitioner, because the way in which I see and feel energy is that basically I become like a human MRI machine, or some people refer to me as the lie detector, because I can not only feel what is going on in your body. So if I have a client on the table, or even just standing at the arena, I had a dad ask me, "So how does it work? How do you feel it?" I'm like, "You're having some right hip pain right now? And is it radiating onto the left side and down your left knee?" And they're just like, "How do you know that?" My body will mirror whatever's going on. As soon as if I open that channel, I'll be able to mirror in my body what's going on with yours so I can feel then what's going on in your body. And then I'll see imagery to then know what's that stemming from, but also how we can move and release that. So sometimes I'll have someone come in with grief or knee pain, and we'll track that back to a divorce or losing a grandparent when they were young. When we have these big T, little t traumas, or just anything in our life, right? Our body keeps score of absolutely everything, every interaction, everything we witness, everything we think and hear. So when we have these things compile onto each other, they're going to begin to cause some stagnation within our energetic flow, depending on where they're showing up. So we have 7 chakras in our body, 7 main chakras. They run right down the midline. And I like to refer to them when we're born as brand new CDs, right? When we open the CD case, there's not a scratch on that CD. I'm dating myself a little bit. And they play effortlessly. There's no skipping. They're just perfect. That's like our energy when we're born. It's pure. There's no stagnation, depending on assuming that our birth was flawless and very peaceful. Now, say we go down the road and we're waiting all week to go out for ice cream with dad because dad promised us ice cream on Friday when he's done work. We love ice cream. We step out of the ice cream parlor and our ice cream cone falls. Something we love has left us. It doesn't seem like a big deal. It's something very materialistic. It's not a big event, but something we love has left us. We go further down our timeline and grandma passes away. Something else we love has left. Maybe boyfriend, girlfriend breaks up with you. That's something else. Maybe parents divorce. Maybe best friend moves away. It keeps going and compiling until you can possibly grow up to be an adult that is too scared to love because everything you love leaves you. So now we have this wound within our heart chakra and our root chakra that is too scared to open up. We have this stagnation that's deeply embedded in our body, and it's showing up in different ways. It might show up as asthma, it might show up as anxiety, it might show up as low back pain, because if it was related to our roots, our family, our foundation, it's going to show up in our lower back because it's our root chakra. And what I do with energy is then we go in there and we discover what's the root cause. What is the depth of this ailment that's presenting to you currently right now? And it's like Jenga. We want to pull that block out, but instead of keeping the tower nice and tall, we want to crash that tower to the ground so then that energy can clear out and our body can then flow. It's like when they remove a beaver dam and that river can flow freely. That's what we're doing within the body with that energy. We have our rivers, right? That river energy that move through our body, our meridians. And when we get that energy flowing, we're then able to really not only be in a better state energetically, but we're also going to be emotionally more fluid. We're going to be physically be able to really be at a higher version of our physical health, mentally. Everything's so interconnected, right? It's like losing a grandma or losing a loved one. She had that respiratory distress, that continuous respiratory infection. When we removed that ailment, that grief, not only physically she felt better, but mentally and emotionally as well. And energetically, she came in and she was just like shoulders back. She was walking, just her whole aura has shifted and changed. It's really beautiful to look at the energy. And I think we forget a lot about the energetic body. We think more about our mental, physical, emotional body. And I think when we separate ourselves into parts rather than as a whole, we really deprive ourselves from being those multidimensional, multifaceted human beings that we are. And I think when we're able to really connect in and plug in all those parts of ourselves, we're going to not only elevate higher energetically, but we're going to see our physical health take off. We're going to see our emotional, our mental, our jobs, our relationships, and so on and so forth do so much better. It's like a garden, right? You have copper wires grounding through your garden. You're going to see better results because you're amplifying the energy. It's that same kind of mindset there that I see in my practices day to day.
So for people that aren't familiar, or maybe they can get the concept of this energy being stuck,
Yeah.
but they aren't at all familiar with what it looks like to have energy work done. Can you walk them through and I know there's a lot of different modalities here, but maybe walk them through what you do and how you can actually get down and figure out what those root traumas were that have led to that and process them through?
Yeah. So, like you said, there's so many different modalities, and I multiple different facets of energy work because I have multiple different ways in which I go about it. So, I have like shamanism. I studied Peruvian shamanism from Peru. Taken yoga, so I have that knowledge, Reiki, psychic sciences, all those things, and then my nursing background. So I intermesh everything. But generally, if you're coming in for a session with me, so to speak, we come on in, we have a chat, we get to know what's going on. And as you talk, I'm scanning to see not only what's your tone doing, but what's your body? How's your energy reacting? Because I can feel what's going on in your body. So I'm noticing what's coming to the surface. And 9 times out of 10, what you come in for isn't what's really presenting. And so I'll be scanning your body as we're talking. You're telling me what's going on. And then I'll cue you. It's like passwords. It's finding that password that's unlocking that door to something you've buried a little bit deeper. Say you're coming in to deal with grief, and this grief is someone you just lost, maybe a relationship that just ended. But the grief that's really there is the grief from when you were a young child and you lost someone very similar to the person you just lost. So it goes even deeper because it's like you're losing that person again. So we'll talk about that and I'll explain that to you. And then I'll do some breath work with you. I'll do some movement and then we'll go from there. So it can look like doing a cord cutting to release energetic ties. Energetic cords are like fiber optic cables that run between you and someone else. The checkout lady at the grocery store is going to be a much smaller cable than a loved one. Or it could be getting you on the table and physically doing Reiki and moving your energy. And when we move energy, I use gentle hands on. I also work above the body. So I move my hands over. I use different acupuncture points and meridian points to activate, to put in, or to release energy. And it can feel like this calm. It can feel tingly. It can feel a little sharp. It can feel a multitude of different ways. And I talk to individuals and describe it like a massage for your neurological system, right? We get a massage for our muscles. This one's a massage for your nerves. So we're working with your parasympathetic and sympathetic nervous system. So when I'm working with your body, I'm helping you come out of that fight or flight and into that state of just ease. And so the other aspect is sometimes people see things, they'll get messages, sometimes we'll channel loved ones. There's many different things that happen in a client session. Some report seeing lights or colors or thinking about things they haven't thought of. It's literally flipping through the pages of your journal when you were little. All the things that you've suppressed sometimes come up and out, and that can be an emotional release. It could be a physical release, like a jumping or like a muscle spasm, and then a deep release. And for a lot of individuals, a lot of the men especially, I don't know why, but the men seem to fall asleep and go into this trance-like state. The women too, but not as fast as the men. So probably about 80% of the individuals that have a session with me fall asleep when they're in person. When I'm doing it virtually, not so much. But they go into this trance-like state. So it's almost like I put you into this hypnotic state where you're going in between worlds and you're really able to release even deeper those woundings, those imprints you've had from all those things our body holds on to. So it's very gentle, it's very loving and calming. And it's like we're being held in this space where I want to say safe space, but I don't mean safe space where we coddle and we let you bypass. I'm going to call you out on that. I'm not going to be that person that allows you to bypass your BS, so to speak. I'm going to call you out on it gently, but I'm not going to let you bypass that because that's not going to help. But it's literally as though you are able to release all the stress that's been holding onto your body in a matter of minutes. And a lot of my clients say it felt like I just slept for days. It feels like I feel so light. They'll sit up and they'll be glowing. I've had some individuals just cry the whole time. They're like, I don't know where this is coming from. And they'll message me days later and be like, I still feel so light. I feel so clear. I can make the decision that I've been trying to decide on what to do for weeks, and it's finally just so clear to me. So we have really phenomenal results. We have pain release. I've had a lot of women come to me with frozen shoulders. We've had them release. I have one of my dear friends I was working on with another lady. We were doing energy work on her. And after 5-6 years of IVF and infertility treatments, she now has a little baby girl conceived naturally with energetics. And it's been beautiful to see what can happen when you really dive into that world. But it's very gentle and it's very beautiful. And it does make a huge difference in your body's ability to heal itself. You heal much faster. You have that clarity. If you're having anxiety or panic attacks, it tends to cease those because we're getting to the root. We're going in and we're unlocking those passwords to then take out that Jenga piece to let that tower fall, and then you can move forward. So I feel like that's a really long-winded explanation. And I hope it answered your question. But that's what a session with me is. And other practitioners, everyone's so individual with how they perform their own energy sessions, but that's what it looks like with me. It's very hands-on, very interactive.
Yeah, I get virtual or over the phone energy work twice a month with a friend of mine, and I've been doing that for years. And it's like one of those things that I just recommend to do on a continuing basis. It's maybe you've gotten past the point where you've cleared some major stuff, but energy is energy,
Yeah.
right? Like we're always going to get energy cords from other people that aren't necessarily serving us and maybe they get stuck for some reason. Having extra help in releasing those things. And it's like a tune up for your car. I think maybe you said that, but it's like you don't get one tune up and never need another one for the rest of the life of that car. You have to continually keep up on these things. So it's just like an energetic maintenance that I definitely recommend to everybody.
Oh, 100%. It's not a one and done. It's like peeling back those onion layers over and over again until you're not having those visceral responses to your triggers or scenarios which once had a big hold on you. Yeah, I love that.
Yeah, it definitely the onion layers, and you start with those big things first, and you can clear those, and then you can start working on the more subtle things that you may not even be aware of because the other bigger things were like taking the reins, right? So it's one little thing after another, and it just smooths the path.
Absolutely.
Awesome. I know we're about at our time. Is there anything that we haven't touched on today that you want to leave our listeners with?
I think just the one main thing is just not to be scared to stand up for yourself, to advocate for yourself, that you're worthy of having your voice heard. It's not in your head. We get told that so much. So just really allowing yourself the grace and the ease and having that nerve to really stand up for yourself because you're worth it. You deserve the best care always. So really advocating for yourself, regardless of Western or Eastern medicine, alternative or holistic practices, regardless of whether it's at the grocery store or in the doctor's office, just remembering to advocate for yourself because you're worth it. Definitely
Yeah.
worth it.
Yeah, and I'll just add to that to cultivate that trust in yourself and in what you're feeling, and if you feel like you've been slighted or mistreated, don't talk yourself out of that. Don't let yourself be gaslit in that way, right?
100%. 100%. I love how you put that. Yeah. And I think the one thing with that too is with energy work, you're also becoming more and more intuitive with every session you receive. So you're really getting to know yourself more and more. So that's something that's not really talked about either. The more yourself, the more you're going to be apt to advocate more fluidly and with a little bit more accuracy than you may have been able to before.
True. It's tapping into that inner wisdom that we may have been disconnected from before. I think we're so conditioned in society to like just get through the day and we forget to stop and tune in and to connect our mind with our body. So I love that you brought that up because that is an outcome, a wonderful outcome of doing energy work is it teaches you to tie the two together and to feel through what that energy is doing in your body.
Absolutely. And I would challenge anyone who's listening, get off of that groundhog day, off of that hamster wheel, and even set your alarm for 9 o'clock, noon, and 3 or a couple times a day and just have a check in. How am I actually feeling? What is my body feeling like? What am I feeling like emotionally, physically, mentally, energetically? Am I feeling drained? Is this person draining me? Is this job draining me? Am I feeling super happy around this person? I am feeling happy. Does my back hurt? Is my throat feeling activated as I talk? Is it feeling tight as I speak my truth? Just taking those moments to self-reflect throughout the day is going to really be a benefit to your health overall as well.
Absolutely. Even have I had a glass of water?
Yes.
Have I
100%. As
stepped
I'm like,
outside? Have I gone outside today? Have I taken just a moment to sit back and just take a few deep breaths
right?
and then I can continue on my work?
Yeah, it doesn't have to be complicated, right? Taking a few deep breaths before you get out of the car to run in and, be that mom. Sitting in the bathroom at work and just breathing for a few minutes. We can find that space if we allow ourselves to. So just allowing yourself that grace.
Yeah, that's a perfect place to end. Thank you so much for being on. Where can everybody find you?
Thank you. They can find me on Instagram at healing with underscore Sarah. That is my main platform. I'm also on Facebook and TikTok with the same handles. And I also have a website. It's www.healingwithsarah.ca.
Awesome. I'll have that all linked in the show notes, everyone. And thanks again for such a great conversation.
Thank you so much, Holly. You take care.
So, I want to touch on one thing that Sarah mentioned, which is don't bypass your BS. We've talked about so many amazing things within this conversation, but that one little line is so important. We're so used to listening to our own BS and believing it as fact. And working with an energetic practitioner or working on mindset to start to unravel these truths that we have been believing and been telling ourselves over and over is so important in your healing journey. There's something that I learned over the weekend that I want you to listen to and know, okay? Your conscious mind only takes up about 5% of your thinking process on a daily basis. Your subconscious mind, which is all that stuff that programs and runs in the background, is 1 million times more powerful than your conscious mind. So think about that. What programs are you running on? So when I go back again to what she said about don't bypass your BS, this is a process of undoing some of that subconscious programming that has gotten that way simply because we've patterned it that way over the years. From 0 to 7 years old is when we take on so many of our patterns and ways of thinking, ways of being, and that programming just runs moving forward. But those things may not be serving you right now. Those things may have created energy stagnation in the body. And that stuck energy is now showing up in different areas of your life with physical pain, with relationships, with work problems, with financial issues, with anger issues, with addiction. So, working with an energetic practitioner or working with somebody on mindset to dive into those root causes, as Sarah was talking about, can make huge shifts in your life because now you are reprogramming the subconscious mind and powering it up with things that will serve you as you move forward. So, with that, there's so many other amazing takeaways from what we talked about, but that's what I want to stick with you as you move forward in your day and your week and the future months. I want you to start asking questions like, is this real? Do I believe this? Is this pattern serving me? And that'll start to give you clues on maybe I could work on this. Maybe I can shift some things. And if you need help with that, reach out to Sarah, reach out to myself. Mindset and limiting beliefs, these are things that we cover first and foremost in my coaching program because, as Sarah agreed, these are the root causes behind the things that we are experiencing today. So empower yourself. Don't let your BS run you. Choose to take that authoritative role and get curious and dive in with one of us. Apply for a clarity call with me. I can't wait to talk to you. I can't wait to see what you are struggling with and how we can set you on a path towards healing by simplifying your health routines and simplifying all the mindset work that's in front of you. And I look forward to seeing you on our next episode of the Health Bridge podcast. Thanks so much for listening. See you next week.